Hey, what's up? It's me. Today I'm going to be a little risque and sassy. I always like to talk about the studies that are in contradiction to what every dermatologist does, because I'm sort of like that black sheep in the group, and I love to be the black sheep because you always learn a little more. So when you look out at the overall studies on sunscreen, they basically show that it does not help to prevent skin cancer. I'm probably going to be the only dermatologist that actually brings these facts to you, but they have not any real good proof that it can help to prevent skin cancer. There are small studies showing it can help prevent squamous cell carcinoma in situ. That's one type of skin cancer. And in Australia, they've done some longer-term studies for melanoma, and there's 1 or 2 studies showing that there's decreased melanoma if you use sunscreen. However, not the way we use it up in the USA. How they do it in Australia and how they did it in the study is every person wore the sunscreen head to toe every day under their clothes, whether they went to the beach, it was raining or cloudy. And only in that study did they show some positive benefit from the sunscreen. Now, who is going to be wearing sunscreen from head to toe every day? That's the first question I have. So when you think about sunscreens and they're all talking how it prevents skin cancer, there's very little amount of evidence that prove that. Don't believe me? Type in FDA congressional review and sunscreen, and you'll be able to read all about it. Now, somebody asked me, if you're saying sunscreens have no efficacy and proven efficacy to prevent skin cancer, then why do some of them say clinically proven or this and that? The answer to the question is they're not allowed to say that anymore. And if you go to type in FDA congressional review sunscreens, you will get the whole report. They are not allowed to brand or label that sunscreen anymore to say that it prevents skin cancer, it's clinically proven, because it's not. And then the whole thing about the branding is there's so many other things they're not allowed to say anymore. They can't say it's waterproof anymore because the sunscreens are not. The studies on waterproofing for sunscreen, how it works is you put the sunscreen on and then you submerge the hand for a minute and then you release the hand. And so who jumps in a pool or an ocean for 1 minute? Nobody. So they found that these studies you can't really say are clinically proven to be waterproof because in real life we don't use them like that. So that's illegal now. If we're saying that sunscreen really hasn't been proven to help skin cancer, then the answer is what does? And the only thing that you can say that does is avoiding the sun. So you don't go to the beach, you don't bake in the sun, you don't get sunburn, you avoid the sun, you wear long sleeve shirts, you have hats on, sunglasses, but really the only thing is to not take the sun. Now who's going to do that? I'd be out of a job if everybody did that, but I don't even do that because that's not realistic. That's like saying to avoid butter. Everybody using butter and oil to cook their food. It's just not realistic. So you got to live too. You have to balance out what the studies say and how you live your life. And so you do what you got to do. I enjoy the sun because I like it. I have fun doing it. And I think the fun that I'm going to gain will outweigh the consequences that I may have. And I think most people that have common sense would think the same exact thing. But it has been proven that tanning beds increase your chances of developing melanoma by 75%. And so, I mean, if you're going to avoid the sun, you should avoid tanning beds at least. You don't need to do extra things like tanning beds. And also, I will just say this. They've done studies now on the beauty of skin and what skin is considered more beautiful. And so they've done tan skin versus pale skin, not tan skin. And what they found is the patients that have paler skin that are not tan versus a patient that purposefully tans their skin is considered more beautiful, the paler skin versus the tan. Also, with time, what happens when you tan your skin is that the skin becomes wrinkled, it becomes red, it becomes bubbly, it changes its texture, it feels like leather. The only way now to disguise this is to tan further. So what you find is, as people tan and they age, now they have to tan to hide all the damage that they've done. Versus a person that's really pale, they age better and they don't have to disguise as much as a person that tans. If you want to learn more about these topics, don't just rely on me. I have 23 other doctors that I work with, and you can find all of these doctors at cinederm.com. We're in Brooklyn, we're in Queens, we're in Long Island, we're in Manhattan, and most importantly, all these doctors are prettier and younger than me. You will like working with them better than me. They're fabulous. And if you want one of these younger dermatologists, you can also call and get them by calling 718-491 5800, and they be able to get you an appointment anywhere.